Registered nurse is my topic today. There are many important jobs in the medical field, for example, dentists, pharmacists, and surgeons. Another job that is very important in the medical field is an RN. What is an RN, you may ask? Well, an RN stands for registered nurse. The job of an RN is to assist and evaluate the patient's needs, create a plan of care for the patient, administer the patient's medication as told by the doctor, and also to order and evaluate diagnosed tests. Their education. License and education vary from state to state, but they usually fall in the same area. What they will look for is a BSN, which is a Bachelor's of Science degree, a ADN, which is Associate's degree in nursing, or just a regular diploma in nursing. In some colleges, though, ADN programs are available and can be completed from 2 to 3 years. Their salary. RN salary can vary on where they work at, whether they work at a school, hospital, for the government, or a private physician. Their top 10 annual salaries from $51.22 an hour, more than $106,530. Their median annual salary is $71,730 an hour. The bottom 10% annual salary is $24.42 an hour, less than $50,800. There are many skills required to be able to be a RN. Of course, like any other job, needs certain requirements. Some of the requirements that may be needed or are used a lot is multitasking, organized skills. You gotta be very organized, so you can know what is where and who is where, because of course you're gonna be working with people, so you need to be organized. Emotionally stable. Of course, you got to be emotionally stable, because there will be days or times you will be dealing with tough situations and easy situations, if that makes sense. So emotionally stable. You have to be compassionate. You gotta have compassion in the job that you're doing. Critical thinking skills, listening skills, and speaking skills. 5 job pros. Number 1, helping others. You help others feel better. 2, work robe. The scrubs are definitely a very comfortable dress wear, I guess you can say. I've never wore scrubs myself, but I'm pretty sure, they're pretty comfortable. They look comfortable, if you ask me. The earning potential, the pay is good. I guess we shouldn't think about it that way, but you're getting paid well while helping others. If you like helping others, then that's good. Who don't like money, right? Flexible hours for sure. Diverse opportunities. You could go out into the military bases, to cruise ships, and even airplanes. So you're not just, so when you listen or you hear about somebody saying, oh, I'm a nurse, well, they're not just always nurses at hospitals, schools, or stuff like that. They're all over the place. They're over military bases, like I said, cruise ships and airplanes, many other places. 5 job cons. The virus exposure. Even though you are helping others in need, you are also exposed to their sickness and could catch it, whether it's around or not. Long hours, for sure. You should have already know that it's gonna be long hours at the hospital or at schools, 8 hours at school or whatever. So long hours for sure. Stress and pressure. That's always whatever job you work at, that's always going to be there. Stress and pressure over whatever you're doing. Emotional burnout. We all are humans and we have a heart and feelings. So, of course, you're going to be emotional and stuff about situations. Like I said, it's always crazy days, there's always calm days, but you just got to be ready for anything that comes to you. And physical demands. Physical demands as in pain in your legs and your back, in your arms, because you will be carrying patients. Well, not carrying patients, but you got to be helping them transfer from the bed to a wheelchair, from a wheelchair to a bed, or maybe helping them go to the restroom. So you're going to be carrying heavy weight with you and stuff. So those are some cons. The job environment and RN's work environment, it may vary from hospitals, like I said, to doctors' offices, nursing care facilities, home health care services, correctional facilities, schools, etc. RNs must be flexible, like I said, and be able to work irregular hours and be able to come in if needed. So if it don't matter if it's weekends or holidays. You see, if you're a nurse, you should know that you're gonna get called any minute. They're gonna need help. They're short on staff, or they just need extra help, and they need you to come in. So you should be able to come in, because you're saving lives and stuff. You just gotta think about it that way. Nurses that work at schools and physicians' offices, they usually get more regular hours, so they're not coming in like if somebody don't come, stuff like that. It's just regular hours, let's just say that. The job outlook for RNs is looking pretty bright. The career growth is expected to grow much faster than average for all jobs, and 50% between 2016 and 2016. The U.S. Bureau of Labor Statistics predict that RNs are working forward to an excellent job outlook. And these are my sources I have used. I kind of I enjoyed looking up, all this information and stuff. I did learn a lot. I did look up in other websites and stuff. But these were the two main websites I used. So